All right, I think we'll go ahead and get started. So good morning, good afternoon. Welcome to today's webinar on program evaluation. This is a part of a monthly webinar series hosted by RAISE and NASTAD. RAISE is the Research Alliance and Implementation Science to End HIV Hub, which is a part of the University of Washington's Fred Hutch Center for AIDS Research. And if you're not familiar with NASTAD, we are a national nonprofit public health association that supports health departments across the U.S. and its territories. And we are also the national technical assistance provider for the Ending the HIV Epidemic Initiative, or EHE. You can learn more about RAISE and NASTAD. I'll be putting some links in the chat. And so our goal through this partnership is to advance EHE implementation through various means. And so we encourage you to reach out to the RAISE team if you're interested in learning more or interested in seeing how implementation science can support your EHE work. Today's webinar is being recorded. We will be sharing the recording with folks who registered, as well as on NASTAD and RAISE's website. So our presenter today is Dr. Roxanne Kerani. She's a research associate professor in the Department of Medicine at the University of Washington, and also the adjunct assistant professor in the Department of Epidemiology, also at the University of Washington. She's also an epidemiologist at Public Health Seattle King County. Her current research is focused on identifying missed opportunities for screening for and treatment of HIV and tuberculosis in the African immigrant and refugee populations in the U.S., and evaluating the extent to which local transmission of HIV is occurring within these populations. Her research interests also include public health practice regarding HIV and sexually transmitted diseases. So I will now pass it to Roxanne to kick off our talk and discussion for today.
Thank you, Krupa. I'm going to share my slides and we will take off. Welcome, everyone. Thank you for joining. Glad to see such great attendance here today. I'd like to thank Krupa and the members of RAISE for giving me the opportunity to present on program evaluation. And I also want to give credit up front for many of the slides that I'll be sharing today, which were developed by Dr. Sarah Glick and Dr. Christine Kozrapour for a course on program evaluation for health department epidemiologists. That course is usually held over a two and a half day period. So this is a very high level overview of program evaluation, but hopefully it will be enough to whet your appetite and raise some questions. And there will be time for questions at the end. Please also feel free to put your questions in the chat as we go. We will be monitoring them. And if I don't have a chance to answer questions during the talk, we'll definitely get to them at the end. So an overview of the talk, I'll be talking about the program evaluation framework that CDC uses, a hypothetical program that we'll talk about evaluating for the purposes of having an example while we're going through this framework. We'll go through each of the 6 steps of the program evaluation framework, and then I have just a couple of concluding slides. Before we get started, I'd like you all to add one word to the chat about how you feel about program evaluation or your previous experiences with it, just to get a temperature check of who's in the room and what you all have done before. Thank you, Hope. I see the first response. I just want to say before we get started too, that many of you have probably already been doing program evaluation, or at least pieces of program evaluation in your everyday work. And maybe it hasn't been as formal as what I'm going to be talking about today, or as systematic as what I'll be talking about today. But we all, I think, do aspects or pieces of program evaluation, and it's just kind of bringing all of these things together and making them more systematic. And that's really what we're going to be aiming for today. So this is the definition of program evaluation that CDC uses. Effective program evaluation is a systematic way to improve and account for actions by involving procedures that are useful, feasible, ethical, and accurate. So I want to highlight a couple of words here. It's systematic, and we're using program evaluation to improve what we do. And we want program evaluations that are useful, feasible, ethical, and accurate. So I'll come back to those pieces. But really what we're trying to do with program evaluation is, sorry, I'm having some problems advancing my slides. There we go. We're really trying to find out whether the work that we're doing makes a difference and whether there are any areas for improvement. That's our overall arching goal for program evaluation. This is the framework that CDC uses, and I'll be basing a lot of my slides on this framework today. It includes the 6 steps of program evaluation. And as you can see, the way it's presented here, it's iterative. So you collect information, you maybe go through a round of program evaluation, and then you go back and start all over. So you may make changes to a program, you may start a new program as the result of one program evaluation, and then you start the process over. And again, the standards here in the middle of this figure are utility, feasibility, propriety, and accuracy. You want your program evaluation to be useful for your health department, for funders, for other people who are impacted by it. You want an evaluation that's feasible, that is ethical in terms of getting ethical clearances for any things that might need it, and that provides accurate data on your program. These steps, when we dismantle that circle and look at them all in a more linear way, include engaging stakeholders, describing the program, focusing your evaluation design, gathering credible evidence, justifying conclusions, and using and sharing lessons learned. We're going to go through each of those in a moment, but first, I want to note that it's very important that you write down your evaluation plan before you begin. This will be, the evaluation plan will be the roadmap for your evaluation. And as you'll note, as we go through many of these slides, you may come up against issues or challenges that if you didn't have this roadmap in place, you wouldn't have thought of far enough ahead of time to address them. So your evaluation plan should really include all of these steps and all of the kind of mini steps inside of each of these steps that you're going to do in order to complete your evaluation. The CDC's website around program evaluation is actually very good, and they have checklists that you can use within each of these steps. They provide a lot of advice and useful information. So if you are new at this and you're interested in learning more, I would suggest that you check out this website. Okay, so the hypothetical program that we're going to be considering as a program that we want to evaluate for the purposes of an example today is an EHE-funded program to increase the uptake of PrEP among men who have sex with men through syphilis partner services. We know that men who are diagnosed with syphilis, MSM diagnosed with syphilis, are at high risk of acquiring HIV in the months and years following their syphilis diagnosis. So this is a program that's really focused on that population that is at significant risk. Throughout the presentation, when I'm talking about this hypothetical program, I'll use the icon, the Syphilis is Rising icon, which is part of a campaign that we did here in King County, Washington, just to flag the cases where we're talking about, the slides where we're talking about this example program. So the first step is engaging stakeholders. This means fostering input, participation, and power sharing among people who are invested in your program and who are impacted by the program and the findings of your evaluation. Why do we want feedback from this group of people? Because it can improve the utility of the evaluation, It can improve the credibility of your results. It can enhance the cultural competence of your evaluation and the way that you are carrying out the evaluation. And it may avoid potential conflicts from the beginning. As I noted before, stakeholders are invested in the program, they're interested in your results, and they may have a stake in the results and how the results will be used to either improve the program or perhaps develop a new program. So it's important to think about who is affected by or involved in your program. Types of stakeholders typically fall into kind of 3 categories or buckets. We'll be looking primarily at the top row of this table. People who are involved in program operations may include staff, funding officials, and partners in the community. People who are served or affected by the program could include people or organizations directly or indirectly affected by the program. And the users of the evaluation are the people who are in a position to decide something about the program and use your results to make that decision. So you should think about people in terms of these 3 groups. There's also another sort of special kind of stakeholder that you should consider before you get started. I know that for many of you who are in local jurisdictions, you may not have control over your own data, depending on what the data is. So you want to take into account people who have control of the databases that you will want to use for your project, for your evaluation. That can include people who have oversight of the program or people who just have access to the database and kind of control that access. Thinking through your data sources ahead of time will help you identify the people who you might have to contact in order to get access to the data that you need to complete your evaluation. There are restrictions, of course, for some databases that make access difficult for people outside of the program, particularly those that relate to federal programs, usually. So take this into account. Think about the people that you might need to work with in order to get the data and bring them into your evaluation early on as a stakeholder. You may have meetings with your stakeholders or interviews. You could solicit written responses depending on where people are. You could include surveys or questionnaires, maybe for community members. And another thing to keep in mind is how you will keep your stakeholders engaged throughout the evaluation. While program evaluation itself is an iterative process, these steps along the way are also somewhat iterative in that you may want to come back to your stakeholders and see if they agree with the objectives that you write or the description of your program or even your analysis plan. So keeping that in mind up front and thinking about how you will keep people involved is important for your evaluation plan. So for our hypothetical program to increase the uptake of PrEP among MSM with syphilis through partner services, our stakeholders might include field services staff and their supervisors, program leadership, EHE coordinators in your jurisdiction, maybe community members or CBOs that refer people to PrEP providers, and the providers to whom the patients might be referred for PrEP. These are all people that you may want to talk with as you're developing your evaluation plan and get feedback and input from them. Probably for people that are internal to your organization, meetings will work to engage these stakeholders. But for people who are external, you might want to consider doing interviews either by phone or video conference, or maybe collecting information through surveys or questionnaires, depending on the stakeholders. Moving on to step 2, which is describing your program. This is an area where there is a lot of back and forth between describing and engaging the stakeholders, particularly for people that are internal to the program. So if you are one person or 2 people working on the program evaluation, and you're at this step where you're describing the program, you definitely want to go back. You'll want to go back and share your description of the program with those stakeholders and get input on your description, because they may have things to add or may see things that you're missing that will help more fully describe the program. When you're describing the program, you want to think about what it is that you are trying to evaluate. What are the activities that are included in the program, the resources needed to have the program, and your expected effects of the program or outcomes. And those outcomes can either be short-term outcomes or long-term outcomes, depending on what you're interested in and also the amount of time that you have. So again, remember, we want the program evaluation to be feasible. And if you're interested in a long-term outcome that might take several years to be able to see, maybe that's not the best outcome to measure. This is an example of a logic model for our prep program with MSM, for MSM with syphilis. A logic model is really like a pictorial. It's a way to describe your program in a visual way, I guess I would say. And this is a very simple logic model. There are definitely more complicated ones out there, but it gets at what I think are the main things to consider when you're describing your program. You want to think about the processes involved in the program. So for example, inputs are resources that you'll need to do the work. Activities are the ways that you're carrying out the work, and outputs are the activities that result as a result of that work. So for example, for our syphilis example, syphilis partner services example, the inputs or resources might include your staff, funding, and a database if you have to create a new database or revise an existing database. Activities might include staff trainings or provision of partner services to MSM with syphilis. And the outputs might include the number of interviewed MSM and the number and quality of trainings around PrEP and PrEP referrals through partner services for DIS. Impact evaluation is more about the sort of broad or long-term impact of the program. While there can be short-term outcomes, intermediate outcomes, and longer-term outcomes. So for example, for our syphilis program, for a short-term outcome, we may be looking at increasing the proportion of MSM with syphilis who are referred to PrEP. That's something that we can measure in a relatively short period of time. An more intermediate outcome might include an increased proportion of MSM who are started and retained on PrEP. And then a longer-term outcome might include reduced HIV incidence among MSM with syphilis, which again might take some time for you to be able to see that in your data. And so this is something where you would want to consider how long it will take in order to see that impact when you're developing your evaluation plan and deciding whether you have that much time, whether it's feasible to measure a longer term outcome like that, or whether you should focus on one of these shorter term outcomes, which will be easier to measure. Okay, that was a quick description of how to describe the program. There are a lot of other logic models online, and I really hope that if you're interested in doing something a little more detailed, that maybe you could look for resources on logic models, which really help lay out all of the pieces of your program. Now we're going to move on to focusing your evaluation design, or how you're going to use the data to do the evaluation. First, you should consider your program's objectives. And objectives may either be a part of this evaluation design step, or it could be a part of describing the program. It's up to you in terms of where it fits best in your evaluation plan. But you can use those objectives to make an evaluation question. You'll want to, again, consider whether data are available to answer that question. And you want specific questions that can be answered and have measurable outcomes. Again, I want to refer back to one of the very first slides showing the evaluation framework used by CDC. And think about those standards that were in the middle of the circular figure. You want your evaluation to be useful, and you want to think about how people will use it. It should be feasible, so you need to make sure that you have the resources that are needed to complete the evaluation. You should consider whether you need to perhaps get permission to use certain kinds of data, or whether you need to seek out human subjects approval if you're doing that kind of design. And finally, what kind of design will ensure that you get the most accurate results possible? So all programs are designed to change something. Your program objectives should include the source of the change, who will be changed by the program, what will change, over what period of time, and by how much. And when you lay all of these things out, it makes developing your evaluation question much easier. Other suggestions include having only one source and end result per objective, and again, including results that are observable and measurable. It's also important to think about using action verbs. So you want to see things that increase, improve, or implement versus more descriptive words such as explore or understand. This slide shows an example of a more general prep program evaluation and program objectives. So the very broad objective at the top of this figure includes reducing incidence of HIV among MSM. As you work your way down the figure, the outcomes become more specific, or objectives become more specific. You should also consider whether your program evaluation will cover data that are collected on a county-wide or jurisdiction-wide basis, or whether your evaluation will be focused on one clinic or provider, perhaps your local sexual health clinic. So going back to our hypothetical program of using syphilis partner services to increase the uptake of PrEP among MSM with syphilis, a draft evaluation question could be, can STD partner services, or more specifically syphilis partner services, be used to increase PrEP uptake among MSM? However, if we think a little bit more about those various categories, it helps us write a much more specific evaluation question. So here, the source of the change will be our partner services interviews. The people that will change are MSM with syphilis, or you may want to consider including DIS, who will be trained to refer people to PrEP. What will change is the uptake of PrEP. We're going to look at it over the period of 1 year. We think that it will increase the uptake of PrEP, this program, and we hope that it will increase uptake of PrEP by 20%. So once we have all of those things laid out, we can put them together and write a much more specific evaluation question. In the year following the implementation of PrEP referrals by field services staff among MSM with syphilis and county-wide, what proportion of MSM receiving partner services are newly started on PrEP? So that's an example of an evaluation question that could be used to evaluate our program. Your impact questions can sort of get at different things. So this one really gets at that broad level impact. After 2 years of referrals for PrEP through partner services, did incident HIV diagnoses decline among MSM reported with syphilis in county-wide? So it's still really looking at MSM reported with syphilis, but you're looking at this longer-term outcome of HIV incidence. You can include other impact and outcome questions. For example, you may have a question with no assumptions about the direction of the effect if you're really not sure. Although in this case, I would hope that we would think our program would increase the uptake of PrEP. After the 2 years of referrals for PrEP through partner services, Did the incidence of HIV diagnosis change among MSM reported with syphilis in County Y, and by how much? Or you can look at some of those shorter term outcomes that were in one of the tables in an earlier slide. For example, did PrEP uptake increase by 20% among MSM with syphilis? Or did PrEP referrals increase by 30% among MSM with syphilis? So it's up to you to think about all of these different pieces of the evaluation question and think about how you can be the most specific in order to put your question together. You can also have process and implementation questions that get at some of those process outcomes. So for example, during the 2 years of referrals for PrEP through partner services, how many MSM received partner services for syphilis? Or during the 2 years of referrals for PrEP through partner services, how many trainings around PrEP were held for field services staff? Both of those are process outcomes that help you know, for example, if you're only interviewing 20 MSM per year for syphilis, it's probably not going to result in a huge uptake of PrEP among MSM with syphilis because you're just not interviewing that many MSM. So in some cases, it's really important to measure these shorter term or process outcomes. I couldn't really think of an example of the number of events for this kind of hypothetical program. So if anyone has any ideas for a type of event that might be associated with trying to increase the uptake of PrEP through syphilis partner services, please feel free to add that in the chat. You can use different kinds of study design and program evaluation. And so many of you who are epidemiologists here today will recognize these things. An experimental design involves randomizing people to one intervention or a control. A quasi-experimental approach might include a non-randomized intervention that you'll use to include people in the intervention to a non-equivalent group. You can also use observational designs, and I think a lot of times program evaluations use observational designs. You can use prospective or retrospective data to look at outcomes over time between two groups with different exposures. You can use cross-sectional data to look at exposures and outcomes at the same time. You can examine outcomes before and after an intervention, or use descriptive studies. Descriptive studies are used often in program evaluation, and while no comparison group is definitely or must be included, it may be helpful to have a comparison group in order to contextualize your findings. So, for example, you may consider reporting your outcome compared to your program's goals or your hypothesis that you included in your evaluation plan. For example, when we were thinking of our syphilis partner services program, we thought that we could increase the uptake of PrEP among MSM with syphilis who had partner services by 20%. So we use that as kind of a measuring stick to which we compare our progress with the data that we're collecting. We can also compare our outcomes to those of other programs or programs in other jurisdictions and across different time periods. So for example, if your program is new, but you have the ability to measure your outcomes from earlier time periods, you can compare the uptake of some service, for example, HIV testing, before and after you implemented the program. So some potential comparisons for our hypothetical program to increase PrEP uptake through syphilis partner services. Assuming that we measure uptake of PrEP for a 1-year period, as we said in our evaluation question, we could compare the uptake of PrEP among MSM with syphilis during the evaluation period to MSM who are interviewed for gonorrhea partner services, to MSM with syphilis prior to the implementation of this program. We could look at the uptake of PrEP among MSM with syphilis in other jurisdictions that might be collecting the same data. And you can again measure it against a predetermined goal for your program, which you should lay out in your evaluation plan. And before we leave this step, I just want to say that evaluation design typically includes a much more detailed analysis plan, which I'm not going to get into today because I think that's a little beyond the scope of our 1 hour together. But that's something to really think about. And if you have epidemiologists in your health department, you may want to consult with them, or if you are an epidemiologist, you may want to chat with other EPIs just to have somebody else get eyes on your evaluation design and see if there are any things or changes that they would suggest. Next, we're going to move on to what for me is the exciting part, gathering your data. So you have a couple of options for data and collection, including what you're currently collecting. So for example, you could use STI surveillance data or HIV surveillance data, or you might want to collect or need to collect new data to complete your evaluation. This could include changing your current your current data source or database to add questions or fields to the database if you're not currently collecting the data that you need, or you may need to create a totally new database from scratch. So when you're thinking about identifying your data sources, you need to think about a couple of things. Are the data available? Is there a way that you can get the data that you need to evaluate your program? You should think about the data that are available. Again, who you need to contact in order to access the data if you don't have immediate access to them, and whether you need to make revisions to a current database in order to collect the data that you will use to evaluate your program. Remember that identifying and accessing data can take several months, particularly if you need to obtain permissions from other jurisdictions, for example, a state health department, or complete data sharing agreements to be able to access the data. You may also need to obtain human subjects review in order to access the data. So again, keeping track of this and sort of working these steps into your timeline is important in order for your evaluation to be done in a timely way and be useful. So these are some examples of HIV and STI data sources. They include HIV and STI surveillance data, HIV and STI partner services data, things like Ryan White data, and data collected via the Medical Monitoring Project. There are other federal data sets, including SAMHSA, Medicaid, and HOPWA. You might want to collect clinical data from a local clinic, for example, your local sexual health clinic, or programs like the National HIV Behavioral Surveillance System or Evaluation Web. You may also consider, if you're looking at one of those longer term outcomes like HIV incidence, you may need to use census data or vital statistics in order to get your population size in order to calculate your incidence. I should note before leaving this slide is that ideally you might have different ways to measure the outcomes that you're interested in. So you may be able to, for example, measure your uptake of PrEP through syphilis partner services, through your syphilis partner services data and STI surveillance data. But if there are questions about syphilis diagnosis and the uptake of PrEP in other programs or surveillance projects, such as the National HIV Behavioral Surveillance Project or system, you may be able to use those sources to kind of triangulate the data and get an idea of what you see when you use different data sources. You should also think about whether you might need to link databases together in order to complete your evaluation. There may be metrics that are available in different databases that exist separately from one another. For example, HIV and STIs databases are often in different databases, but many of those often have common fields that you can use to link between them. For example, name or date of birth. So for our program to increase PrEP uptake through syphilis partner services, we would definitely need STI surveillance data to identify our population, MSM with syphilis. We would need to use STI partner services data to measure our outcomes of maybe PrEP referrals and PrEP uptake. We would probably also want to use HIV surveillance data in order to identify MSM with syphilis who are not currently living with HIV. Or if we're going to measure one of those longer term outcomes, looking several years down the road, if we want to measure HIV incidence among MSM with syphilis, we'll definitely have to pull in HIV surveillance data. You may need to think about additional databases if you're not currently collecting the data that you need, or if you don't have control over the data source. So I know that for many of us, we don't have the ability to change our databases, especially those that collect partner services data. So you may want to think about developing supplemental databases that can be used in conjunction with your current database in order to collect the data you need. So for example, if in your current STI partner services database, you don't currently collect data on PrEP referrals and PrEP uptake, it might be necessary to develop a different database or a different way of collecting those data, which can then be linked back to the STI and HIV surveillance data. Justifying conclusions. I have just a couple of slides here. Justifying conclusions is really putting it all together. You analyze your data and then interpret the findings. When you interpret the findings, a couple of things that you should consider are how you organize them, the context in which the evaluation took place, what the practical significance of your findings are. You should also think about what is working well in the program and what is perhaps not working well. Be sure to describe the limitations of your evaluation and then contextualize your findings through comparing what you found to what different programs are seeing or what has happened at different points in time. This is something, again, that comes from that CDC website, and I would refer you to that program evaluation website if you're interested in learning more. Finally, we get to using and sharing lessons learned. So this is really about disseminating the results of your evaluation, which of course is important if you want your evaluation to be used. If you do the evaluation and no one ever sees the findings, it's not going to be very helpful. And so you really need to think upfront about who to share the data with or the findings with and how to do that. You could disseminate your evaluation findings in different ways, but you need to tailor it to the stakeholders that you want to deliver those findings to. So you may prepare a report that includes your findings. You may do a presentation. You could describe your findings in newsletters or blogs or some other way that your health department has to communicate information to stakeholders. You might include the findings on your EHE-focused website or another website that your health department maintains. And there may be lots of other ways to disseminate evaluation results. For example, through social media, if your health department has a social media presence. Some things that are really important to include in a report, if you're going to do a report, are a description of the stakeholders that you engaged and how you engaged them. You need to include that description of your program, maybe in a little bit of a shorter fashion, a less detailed version of your program description, but it's important to have that in your reports. You should include an adequate summary of your plan and the procedures that you used. So basically the methods of the evaluation, including technical information. You need to think about and explain your conclusions and how you came to those conclusions, how they're supported by the evidence that you found. You should list strengths and weaknesses of the evaluation, and then produce recommendations for action, for changes that can be made, including recommendation advantages and disadvantages, as well as resource implications for your program or health department if those changes will be made. If we think back to one of those early slides with the program evaluation framework, that figure in a circle, and think of the standards in the middle, utility was one of the standards. And I've mentioned this 1 or 2 times before, and that's because it's so important. You want findings that are useful to your health department and your stakeholders. These are some things that might influence the use of your findings of your program evaluation. The evaluator credibility. So is it someone who's been with the health department for 10 years versus a student, or who is doing the evaluation? The clarity of your report or presentation, the timeliness and the way that you disseminate your findings, being sure to disclose your findings to all of the stakeholders, being impartial in your reporting. Of course, changes in programs or organizational context, or I would say funding, is an issue that we've all run into over the last couple of years in terms of thinking that we're going to have funding to do certain things and then it goes away. Not having funding that you thought you might have is definitely going to influence the possible use of your findings. And finally, leadership buy-in is an important thing to consider when you're thinking about how useful your program evaluation findings will be. Does your leadership believe in your program, and do you think that they are willing to make changes to it as a result of your findings? So wrapping things up with some examples of sharing results for our hypothetical PrEP and Syphilis Partner Services program. We might want to give scientific presentations about our evaluation findings, because these results will be of broad interest to the community of people who works on HIV prevention, and in some cases, people who work in STI prevention. You might want to produce reports on this program evaluation for leadership, program staff, and your funders, especially EHE funders. And you may want to think about including or holding community meetings and town halls in order to provide this information with community members and local organizations that you work with. As I said at the beginning of this webinar, this is an iterative process. So after you've done your evaluation and you make changes, or you decide to do something new, the cycle may start all over again. And that's something to keep in mind also when you're planning your evaluation, is what might be the repercussions or the work that will come up down the road, depending on what you find from your evaluation. So heading back or thinking back to the definition of program evaluation provided by CDC, that it's a systematic way to improve and account for actions. Again, it's really, program evaluation seems maybe mysterious or kind of overwhelming for some people who haven't done it very often, but really it boils down to whether the work we're doing makes a difference for the populations that we're working with, whether there are areas for improvement in that work, and whether we're using our scarce public health resources wisely. Do we want to keep funding a program if it's not producing the outcomes that we think it should? Before I close, I just want to note that RAISE is also hosting an Evaluating EHE Implementation workshop. I think the applications have closed on this. Krupa may weigh in on this, but we may be holding a similar workshop next year. It's really geared towards health department epidemiologists to help them conduct evaluations of EHE work. And so if you are not able to attend this year, I hope that we may be able to do the same next year and that you will consider attending. I'd like to thank everyone for your attention. Please feel free to email me if you have questions that we don't get to during our Q&A time. I would be happy to answer any questions. And thank you for your attention.
Thank you, Roxanne. As Roxanne and Emma mentioned, we're still accepting applications for this workshop that's happening in May in Seattle. Emma put the link for the website with more information in the chat. You can also scan this QR code with your phone. And the application deadline is this Friday. Also want to let you all know that our next webinar will be on Thursday, February the 29th at 2 p.m. Eastern, 11 a.m. Pacific time. So save the date for that. And please feel free to reach out if you have any questions or would like any additional information. Roxanne also provided her email address, so feel free to reach out to her. And thank you all so much for joining us today. We'll see you next time and have a good rest of your day.